At the Department of Health Professions Education, we are taking a forward-looking stance on the use of AI tools in your coursework. But that also means that we need to set up a few guidelines, and this video will go over the guidelines that the department is following currently. So to begin with, this document is linked in your course syllabus. You can read it for detailed information. This is a quick overview. Most generative AI tools are permissible in your courses. So for example, ChatGPT, Claude, Grammarly, Copilot, you can use them for different things like checking your grammar, your writing style, providing summaries, different things. What I would recommend is that you clarify the use of AI tools with your course instructor first. Whenever you use any AI tool, you must appropriately disclose the use of that tool. And the information that you need to provide is what tool you used, why did you use it, and how far did you use it? So the extent of use as well. There is an example statement in the document, and you can use that to guide your own statements in all your assignments. Remember that if you do not disclose any AI use, that is considered a breach of academic integrity. Whenever you use AI tools, we encourage this because we want you to be able to use the latest tools and to be able to use them effectively. However, using it effectively means the tool supports you, it does not replace your work. So when you use AI and it generates content for you, you are expected, of course, to review it, critically evaluate and analyze it. You must substantively revise, rephrase, or build upon the ideas from the AI output. Your final product that you submit must reflect your own academic voice and your intellectual effort. It cannot be you putting a prompt into ChatGPT and getting a response and that becomes your assignment. That is completely a case of plagiarism and academic integrity. So if there are assignments that have unmodified or minimally edited AI generated text, that will not meet the criteria for critical engagement, and it might put you up for academic misconduct review. So please be careful. Remember that the product from the AI tools is to help you think better and to polish your writing. It is not to replace your thinking. Whenever you use any AI tools, remember that the work is your work. You take responsibility for the final product, even if an AI tool helped you with it. Submitting it as your own original work is, of course, misrepresentation, and using an AI tool does not excuse inaccuracies or superficial arguments. So you cannot come back and say, well, that citation is wrong because ChatGPT gave that to me. It is your duty as an author to check and verify every piece of information that is in the final product you are submitting. Of course, as health professionals, you have to also be careful about PII information. So that can be patient related or your learner related information as well. And always consider the biases and discriminations built into these tools, and be aware of privacy limitations with these tools as well. Now, non-compliance with these guidelines, specifically making sure that it is finally your work product, may result in your instructors asking you to revise the assignment completely. You might face grading penalties, so grades can drop because of that. And you might also be referred to the Student Progress Committee, and in some cases, there is the potential for disenrollment from the program. So remember, this is a very serious case of academic integrity. We take it very seriously. That said, we do want you to use these tools. Just make sure you're using them appropriately. Any questions? Your first line is to ask your course instructors. You also have Dr. Anita Samuel, who will be available to talk about AI use in a broader context. For your information, these guidelines were generated based on what journals are currently using as their guidelines. So we took those guidelines and have built upon it to give you these guidelines to follow for your assignments.